going to happen is the girls are going to simulate a birth underwater. So here is our pregnant client, and she's about to get gracefully into the bathtub.
Moms usually get into the water around 7 to 8 centimeters of dilatation. And the moment they emerge into the water, the warmth of the water gives them that nice feeling. There's a French obstetrician that we really love his work, Michael Odeur, and he says that if a mother has not birthed 2 hours that she's in the water, she's probably not going to be able to birth vagina, because the water has such calming properties and such pain relief properties. It will help the labor process on. So 2 hours is actually, it doesn't sound long, but to be in the tub, it's long. So the maximum period is 5 hours, so you don't want to exceed that.
Alright, so each midwifery practice does this different. So there's different variations on birth all over the world. We prefer never to do a birth alone, so we will always be 2 midwives during a birth. One will be our second midwife that will be managing the baby after birth, and the primary midwife looking after the mother and the baby from antenatal care will continue during the birthing process and with the postnatal period as well. So during this time, the lights are normally dim, soft music can be playing. We make use of a lot of aromatherapy oils as well, according to the mom's preference. Normally the most frequent ones are geranium, which is called in Afrikaans Roots Malva. It actually smells quite nice. And then lavender, we also make use of clary sage. Clary sage and geranium has contractibility effects on the uterus and can actually help contractions a lot. Alright, so the birthing positions that you can have in a bath, as you can see, Melanie is now in a nice deep squatting position, very comfortable as well. Again, upright, the pelvis is nice and wide and open. She's actually quite short, and you can see the bath is actually quite big. So a dad can climb in with her, support her from the back, so that she's nice and comfortable.
Even lying down. So if they do even choose to birth in a more laid back position, they'll never be flat on their backs. But still in the water you have a lot of buoyancy, so you can move much easier and you're weight free. So you don't have that heaviness preventing you from getting from one position to another.
And a lot of our moms end up in this position without even actually coaching them. This is a position that they will choose for them that's very comfortable. The tummy is hanging in the water, very nice and warm, comforting on the tummy as well. And the doula always has a bag of tricks with all the pressure points that they use.
So another pain management technique that we use is during the contraction, the doula or the midwife, whoever is closest, or the dad, can perform a hip squeeze. So putting your fingers on the sacral area, you squeeze the hips together. This relieves pain, and then after the contraction, the massage of the lower back generally works quite well as well too.
I'm just quickly going to explain our basic essentials. So you will have your sterile birthing tray as you would in a hospital, and then all we actually need is an ambu bag, and you will see it's not connected to oxygen, and then a low suction device. So this is actually, it doesn't look like much, but you will see that it actually can do its work. So during the birth, so I examined Melanie a while ago, and she was almost fully dilated. So during the second stage of labor, we will listen to the fetal heart rate. This is an underwater Doppler, every 5 minutes or every second contraction, before, during and after, to make sure that the baby is still fine. What's nice about the water as well is the bath is quite high, and the mother is always close, so there's really a sense of privacy during a water birth. The mother is never exposed.
Next week we're going to see the actual birth and what they do once the baby has come out. The placenta delivery and the postnatal breastfeeding, and how the doulas deliver their care during the birth process alongside these specialist midwives.